Okay, so today we're going to go through some caregiver resources that are available in Alberta that may help you with not only patient care, but also taking care of yourself as well. Alrighty. All right, so a caregiver is a bit of a misnomer. You're all probably well aware of this information, but we're just going to go through it to ensure everyone's on the same page. A caregiver can be paid or unpaid. So, helping with daily living, support for those with health conditions in a home or a clinic or a care facility. So many of you would be familiar with a spouse or an adult child giving care to a elderly patient or a parent. That would be considered unpaid care. If it's someone like a healthcare aide or a live-in aide, that would be paid. And over 1 in 4 Albertans is a caregiver for a family member or a friend. And unpaid caregivers in Canada give about $25 billion worth of care annually. So they do a lot. It can be cooking, cleaning, financially, transport, medical care. It's a lot to handle. Does anyone here have a family caregiver? It could be a spouse, it could be casual help.
Yeah, I have a grand nephew who is living with me and helps with my everyday life.
That's great to hear. So does he help with like booking appointments or just like keeping the house tidy or errands?
More house tidy and errands,
Mhm.
and I can still do the finances and all of those
Yeah,
myself. So more with the food and keeping the place tidy. That sort of help I get.
that's great. So it looks like we have a comment on the Facebook section as well. I have
Sure.
a caregiver that is my wife. She handles my medical appointments, my medications. She helps with cooking and she helps drive me to my appointments because I find it difficult to drive while using my oxygen equipment, which I need to be on 24/7. Okay, yeah. A lot of times spouses and family members are your caregivers. So we're just going to go through some tools and supports. Has anyone here ever heard of caregiver burden or burnout?
Yes, exhaustion from doing it on an ongoing basis, I believe.
Yeah, it's a lot to handle, especially for one person. It can have a profound impact on your mental, your physical, your social, and financial well-being because it's a lot to juggle. You can lead to stress, fatigue, and neglecting your self-care. So, like Tepan, you mentioned, caregiver burden is the accumulation of all those tasks and responsibilities. When you're stressed out, you could have difficulty sleeping. You might be short-tempered or feeling overwhelmed. It could affect your blood pressure. You might forget things or have trouble concentrating. And the big thing we want to watch for with burden is that it doesn't expand and worsen because then that can become burnout. That's frequent illness, fatigue, anxiety, and neglecting your own needs and self-care, which not only affects you negatively, it also makes it much harder for you to take care of that family member or friend. And the best thing for that is reaching out for support so we can reduce the risk of burnout and limit the burden on one person. Okay, next slide. On our website, we actually have a list of patient resources. Just going to click on that. Oh. Let's see if it'll open. There we go. So I've just opened a website page. Can everyone see it?
Yeah. Yes.
Okay. Alrighty, so I'll just go through a very quick overview. Our patient resources list is a list of things like private, nonprofit, and government supports for a variety of needs. Sometimes caregivers are able to support the patient, but not necessarily provide housing. So in this case, there's a few options. There's the Good Hearts Foundation, which helps people find places of care and temporary aid. So you would find a place to live, and they would find ways to make sure that you could find a healthcare aid to bridge that gap, as well as finding housing for things like out of town appointments, especially as the U of A has one of the biggest catchment centers in the country. So we see a lot of out of province patients here.
Mhm.
Yeah, so the affordable housing program offers subsidizing. So if you meet the financial eligibility, you can use that. There's also the Good Samaritan Society and the Riverside Compassion Home, which is another home for patients, essentially. There's also a specific subset just for seniors housing. So the Greater Edmonton Foundation and SAGE are two organizations that focus solely on seniors housing. The Alberta government is also expanding their subsidized housing for seniors. Right now, they have a very small portion just for seniors, even though it's quite extensive support. They hope to make an announcement on that, I believe, this summer. And once they make that announcement, if it's confirmed, I'll post about it onto the group chat. Okay, and the big one is financial support and coverage. So I did put Alberta Blue Cross coverage here. That's specifically the seniors plan. The
Right.
Alberta's, yeah. So is anyone here utilizing that right now?
What do you mean?
So Alberta Blue Cross has a seniors plan that mirrors the Alberta government's healthcare plan, but it also includes caregiver benefits. So those benefits would apply to both the patient and the caregiver.
No, can you expand on that a little bit? Because I
Yeah,
have
sure.
I have my Blue Cross that way, but that's all that I have. So this is different, right?
Yep, so this would be different. This one is for anyone over the age of 65, and this is a public program. It's a government-sponsored program. So what you would do is after you turn 65, you would contact both the Alberta government and Blue Cross to arrange for a seniors plan.
Yeah, Jamie, it's Lloyd. I'm on that plan right now.
Okay, are you on the expanded one or the
65,
65?
what you have
Yeah.
to be 65 for.
Mm-hmm.
And what
And
do they what do they supply?
They pay for, yeah, drug coverage. I think the most we might pay is $25.
Yeah.
But drugs of any type that are prescription, they're paid for by the government.
okay.
Ambulance, yes.
I must have that because I don't pay for my drugs.
Okay, yeah.
I pay something. Government pays something, but I still have to pay something.
Yeah. Lloyd, do you know if the expansion on that to caregiver coverage is still active?
Well, so Lloyd is actually on palliative care coverage.
Oh,
And-
okay, so
and
that might be
does
might be
extend
separate.
to me, apparently. So I was unaware of that, but yeah, it covers me too.
Okay, so they may have changed it since I last had a good like deep dive in the program, but previously they used to extend that regardless of whether it was under the branch of palliative care or not. I can check in to see if that's the case. I know they've made a number of changes in the last few months, but this should still be the accurate info. Okay. And then I'm sure most of you have heard of things like Alberta AIDS Daily Living, the Alberta Seniors and Child Health Benefit. The one that I want to focus here is grocery support. So that is actually Alberta Lung's own program. What we do is we have a form on our site that patients can click the wrong one, sorry. Patients can access. You fill out the form and generally we just ask, are you in financial need? What lung condition is it for and what medications is it for? Because what this program does is it allows us to give patients grocery gift cards to grocery stores with pharmacies attached that allow you to use that gift card in the pharmacy. So things like Costco, Sobeys, they allow you to do that. And that way we sort of help patients not only afford healthy food, but they can also afford their medications or medical equipment. It also can be used towards paying for a vaccine fee. So for example, RSV, you cannot.
Oh, I wish I had known that. I had to pay for it myself.
Oh no. So after this meeting, we'll be posting all those like links to
Okay.
that, but most pharmacies that carry this gift card that's allowable in pharmacies will let you use it towards vaccination fees as well. It's always good to check with the clinic itself because certain locations have different rules. But essentially it's you fill out the form goes to me actually. And then I would just confirm the information and then based on how much funding I have and what the general cost of the medication is, we would mail grocery gift cards to the patient. So with that grocery support gift card program, has anyone here heard of that program before?
Nope,
No,
Really?
nope.
So Jamie, is it Alberta Lung Association's program?
It is, yeah. So I actually run that program too.
Oh, I see. And is it income tested? You possibly is, right? You cannot afford to give to everybody.
So yeah, so we do have to like limit it to it's a first come, first serve program and it is one per household. So that's just because of increased need. I think it's everyone has realized, thanks to inflation and etc. There's definitely increased need for support. So we're still giving people aid, but it might be just a little bit less this year. And it might be a little bit slower, but we are getting to every applicant.
oh,
Okay, that makes me wonder what other programs you are aware of. But yeah, I'll definitely send everyone the link for that afterwards. Okay, we'll head over to health equipment and other supports. So another program that I run at Alberta Lung is our AeroChamber Inhaler Device Assistance Program. So anyone who uses a spacer for their inhaler, usually for asthma as well as COPD, but we do have some pulmonary fibrosis patients that also use a spacer. We have a agreement with Trudell to identify patients in need. They usually just apply to it through a form on our website, and then I'll vet their application, confirm financial need, as well as what condition it's for. And then once we have that spacer in stock, we mail it to them at no cost. Does anyone here use a spacer?
I don't know what a spacer is.
Okay,
Yeah,
so
I do. I use it.
okay.
So
Tepin, do you wanna give a crack at explaining what it is?
well, I can try. I take Ventolin, 2 to 3 times a day, and my doctor and nurse had said that instead of just pressing the button straight into the mouth, you attach it to a spacer, which is maybe about a 6-inch hollow bottle-looking thing. Both sides, one side totally open, and so there's a place to attach the Ventolin, I don't know what you call little can of the gun-like thing to that. So instead of the spray coming straight to your inside your mouth, you inhale 5 times for it to pace it out, and I think you get the most benefit compared to directly pressing the button. Does that?
Yeah, that's
Is that?
actually a very good explanation. So a spacer or an aero chamber, which is just Trudell's branded spacer, is an attachment that you put onto an inhaler to help you inhale the medication more efficiently. Even with proper technique, it's very hard to not end up accidentally swallowing some of the medication, so it doesn't go where it needs to. With a spacer, you inhale a bit easier, so more of the medication goes to where it needs, and because of that, you end up wasting less medication. And you end up having a faster recovery if you're using that inhaler for breakthrough symptoms.
So yeah, I use it strictly for Ventolin.
So I think Ventolin is probably one of the most popular uses for it for patients with PF. But with this program, it's open to PF patients, asthma patients, COPD patients, basically anyone with a lung disease that uses an inhaler and is in financial need. Okay. All right, then we've got a few other equipment aids here. So Alberta Aids to Daily Living. If you have a disability or illness and cannot afford medical equipment or supplies, Alberta Aids to Daily Living is a pretty good option for that. The medical social workers that I talk to do mention it's a bit of a long wait, but it's still pretty good.
Yeah, some of you know, maybe many of you know that my wife is in a long-term care facility, and she had, sort of like a Parkinson's plus diagnosis. So she has been benefiting from a nicely customized, custom-made wheelchair, and that's 80% funding came from AADL, Alberta Aids to Daily Living, and 20% out of pocket.
Nice. So I'm really glad that they were able to help your wife find equipment that works for her. That's one thing I really like about AADL is not only do they fund equipment, but they're usually really good about finding equipment that works for the patient. So they're very open to funding customized equipment.
Yeah, exactly.
Yeah. Okay, and then the Canadian Red Cross's program is more of a short-term loan for health equipment. It does require a referral, but the HELP program is also quite active in Alberta. You would basically phone up the hotline with the number here. You would explain to them what your health need is, what type of equipment you require, and how long you would require it for. Your doctor would be the one to refer you usually. But it can also be your medical social worker that refers you. Once you go through that process, they'll check to see if they have what you need in their inventory, and then they arrange for pickup or delivery. Okay, we're going to skip those ones because those are cancer specific. There's also transportation services. So Driving Miss Daisy, Drive Happiness, they're both really popular options for anyone with reduced mobility, as well as companion drivers, home care support. So these are things like coming by and making sure you're able to take your medication, picking up your mail, driving you to appointments, things like that. Okay, and then this is the ones that we'll be going through is naturally we have our support groups. There's also two tools. One is Caregivers Concierge, which isn't actually free, so we're going to ignore that one. But Caregivers Alberta is a peer support organization that also has a lot of tools and support group activities, as well as workshops for patients that are really helpful. So I'm going to go back to the PowerPoint. Let me know if you guys can see the PowerPoint.
Yeah.
Okay,
Good.
I'm just gonna hide that. Okay, so we're gonna go through something called Caregivers College. Alberta Health Services has a free education course for caregivers. It can include topics like stress, guilt, navigating medical and support services, how to navigate paperwork, things like that. We're going to go through the two most frequently requested ones, which is tools for caregivers and caregiver self-awareness modules. Okay. And just let me know if everyone sees an Alberta Health Services page.
No.
No.
Okay.
The page in front of us is Caregivers College.
Okay, so does it say Alberta Health Services Caregiver College?
No, just overall, just the two words, caregivers and college. That's the heading.
Oh, okay, so I think you guys are seeing the PowerPoint still, hey?
Yeah.
All right, so I am in the process of switching that over. It should go live in a second. All right, so you should see an Alberta Health Services page called Alberta Healthcare or Alberta Caregiver College.
Yes.
Yeah, okay, perfect. So it's going to be a little bit of back and forth just because there's so many links with this presentation. Okay, so we're going to go to powerful tools for family caregivers. All right, this is just a basic overview of supports and ways for family caregivers to manage just a myriad of tasks, both physically and emotionally and financially, and the burden it can cause. So we're going to click core module 1. We'll go to caregiving journey just to give you guys an example of what the course is like. And we'll play this
Right.
short video. Let me know if you can hear it.
No. We
Can you
can't
hear it?
No, we
Sound
can't.
is not on.
Okay. Okay, so we'll try that again.
Hi, I've been a caregiver for 8 years.
Yes.
Like many of the
Perfect.
caregivers, this role kind of fell onto my lap, most unexpectedly. The young man who came into my care was 30 years old at that time. The SUV he was driving on the highway got hit head-on by a truck, swerved into his lane at 170 kilometers an hour from the opposite direction, driven by a drunk driver. Besides bodily injury from head to toe, MRI showed he has bleeding into the white matter of his brain. And then other tests result confirmed that he has cognitive function damages and other symptoms like PTSD, which is post-traumatic stress disorder. The biggest shock came when the doctor confirmed that brain injury in almost all cases are permanent. So after going through the gamut of disbelief, distress, and tears, we started to think, what can we do and where can we go from here? After searching through the internet, I found two places that could support me as a new and clueless caregiver. I found first one is the rehabilitation at Glen Rose Hospital, and the other one is Brain Care Center. Sometimes when I feel a little overwhelmed by the stress of the situation, I would take out his photographs from before the accident. Looking at those photographs reminds me what a wonderful and dynamic person he used to be. And now he has to go through so much difficulties every day just to get by. That made me realize my caregiving will mean a safer and better quality of life for him. And that always makes me feel what I'm doing is worthwhile. If anyone asks me, is caregiving rewarding? I would like to share this thought with you. I think caregivers are unsung hero working from the trenches, and we play a part in rebuilding someone's life that has been shattered. And that we just may be part of the reason why that someone is smiling again. So, is it rewarding for me? You bet it is.
Yeah, so one reason I like the Caregiver College is it was developed with input and in collaboration with caregivers, so it gives them a really good idea, a good understanding of what sort of information caregivers need, what the caregiver experience is like, as well as how to navigate those supports. Because sometimes, even if you know that there's supports available, you don't really necessarily know how to utilize it, especially with different government levels and paperwork that might be written in medical jargon or legalese. Just going to go back here. And we're going to go to resources and caregiver support. So they have a bunch of things like support and advocacy groups, government programs, disability related legislation, and worksheets. So we're going to go to support and advocacy groups. Okay, we'll go to support groups. So there's two types of support groups that people can access here in Alberta. One is the caregiver support group, providing information and advice, social and emotional support, reducing isolation, allowing caregivers to vent valid feelings and frustrations safely, and provide hope, reduce depression and anxiety. And there's also self-help groups for individuals with a chronic disability. Sometimes you'll have patients do both. So you'll have a group like ours where we have patients and caregivers attending. So this support group would be considered both a caregiver and a self-help group. And in this case, it wouldn't be chronic disability only, it'd be anyone with any sort of chronic health condition. So this support group right now, that'd be an example of both. As you can see, they're pretty detailed. So dealing with communication challenges, depression, intimacy, physical activity, and chronic disability, they kind of run the gamut, which is it's pretty good for detail. So we're going to go to communication challenges, just an example. Okay. All right, so one thing I like about this one is it gives them tools. Everyone communicates differently, so they will explain, the difference between expressive, which is speaking or writing, and receptive, which is hearing and reading. And I'm not going to read all of this. but when you cannot communicate effectively, you may not be able to express basic needs and wants, give information or share thoughts, convey social closeness, and when it's disrupted, it risks the individual being isolated as well as the caregiver not necessarily understanding what sort of support their patient needs. Okay. As you can see, is a pretty generalized one. So they not only will target a general caregiver or a caregiver of chronic disease, but they also care for people with autism spectrum disorder, transitional planning, as well as neurodevelopmental disabilities, cerebral palsy, FASD, so that's fetal alcohol syndrome. Okay, and this is one that we're going to go through. Caregiver self-awareness and self-care. Okay. So with this module, they'll be teaching you how to recognize what self-care is and the importance of it, learn techniques to improve your wellness, and access additional resources. And they go through the gamut of wellness, so physical wellness, mental wellness, emotional wellness. And we'll just go to the fact sheet here. Okay, so these 4 sections, they apply to both the caregiver and the patient. So things like nutrition, exercise, making sure you're hydrated and sleeping well. Mental wellness, that's stress management, journaling, deep breath exercises, social support. Emotional wellness, that's things like recognizing and validating your emotions as well as the emotions of your patient and sharing experiences and understanding other people's point of view. So sometimes a caregiver and a patient may disagree on care. When you cultivate these sort of skills, you can find a way to find a common ground that doesn't harm your patient's medical needs. And then the last one is spiritual wellness. Doesn't necessarily mean being religious. It can be deep reflection, writing out your mission statement, connecting with a higher power, if that is something that you feel compelled to do. Okay, so they even have a bit more detailed. They have caregiver-centered care level 1 foundational. So this is a course that takes all the information from those modules and chapterizes it and put it in a training course. So you can actually earn a certificate in a caregiver-centered care.
Mhm.
Okay. Yeah, and I won't go through this too much, but it's a course that's run through the University of Alberta as sort of a recognition that in Alberta, especially, over 1 in 4 Canadians and Albertans are caregivers. And even though we have the programs and services to support them, we also have to make sure that caregivers are aware of the services and how to use them, as well as giving them the tools and skills to not only take care of themselves, but their patient more effectively. Okay. All right, so I'm going to go back to the PowerPoint real quick. All right, so Caregivers Alberta is a very, very good resource for caregivers. They have resources that can coach you on how to manage your responsibilities. They have workshops and resources tailored to your specific situation. So if you're a young caregiver, so during the pandemic, I was a young caregiver not the pandemic, sorry, during the SARS pandemic about a decade ago, I was a young caregiver for a grandparent. That would be a good resource for me to have used, would be this website. If you're employed, low income, they have resources that are also tailored to that. And their topics are similar to the Caregivers College. It can be stress, guilt, communicating effectively, and navigating those support services. Their two most frequently requested ones are caregiver and disability resources. They also have a YouTube channel with some educational videos. I'll play one just to give you guys an idea.
Any rice is okay. Thank you.
Okay, can everyone see my screen?
Yeah.
Yes.
I'm just gonna lower this for a second. Okay, that's not working. Some reason it's not letting me share it. So I'm just gonna stop my share screen and I'm just gonna put it up again. All right, let's try this again. I might just be upsetting Zoom with how often I'm shifting screen share. Can everyone see a YouTube page?
Yes.
Yes.
Perfect. So as you can see, they have a bunch of videos on things like grief and loss, navigating Alberta Health Services home care funding, caregiving and mental health, financial and legal support, caregiver burden, which we discussed earlier. They also have caregiver stories, which is really good to see. Which video would you guys like to watch? Would you like to watch the one about financial and legal support or accessing home care funding?
Well, you can decide, but home care funding will be, I'll be interested on
Yes,
the
me
home
too.
care fund.
Yeah, I would too.
Okay, I'm going to launch that one.
Welcome, everyone. It's my pleasure to welcome you today. Thanks for attending today's session. So today's session is on navigating the home care funding, AHS home care funding versus the invoicing versus self-managed care. My name is Karenza Pedrobeski, and I'm honored to be here today as your host. I'm a caregiver coach with Caregivers Alberta. We'd like to take a few minutes for the land acknowledgement. So I would like to acknowledge
just going to pause this video for a second. As you can see, it is over an hour. So we are not going to watch the entire video. We're just going to watch a few minutes. And then after the session, this is one of the links that I'll be sharing after the meeting, which everyone can go back to and explore for themselves, just because there's a lot of information to go through.
Okay.
ancestral and unceded
outside of a hospital environment. If you think about primary care, which is, your doctor that you see and maybe other supports, perhaps he or she is part of a primary care network, and you think of acute care, right, at the top of a pyramid. Continuing care is kind of that middle piece where we're providing more support than just seeing a doctor every few months, but less intensive intervention than what you receive in an acute care hospital. We are a publicly funded service. We provide both personal care services as well as professional healthcare services for clients of all ages that are living in the community. So that means that we include children's services, right? Have a children's home care program that support children from birth up to 18 years of age in partnership with other agencies such as FSCD for family supports for children with disabilities. It means that we provide acute services. These are generally for those individuals who require professional assistance for a short period of time. So think someone who's recovering after a surgery, for example, a hip replacement, perhaps needs some short-term assistance in the home, some physiotherapy, or someone who needs a short term of antibiotics, which are delivered in their home. We also provide long-term supports for those with disabilities or chronic illnesses that require assistance on a day-to-day basis to remain independent in their homes. And I'm guessing that for many of you, that is the nature of the individual, the loved one that you're supporting, right? Is someone who has that long-term ongoing need. And of course, we also provide palliative care supports, right, for comfort and symptom management through to the end of life. When I was kind of looking up the scope of the program in preparation here, I didn't want to neglect to mention that home care also has a volunteer services branch. And depending on where you live, as well as depending on your need, there may be volunteer services available through AHS Home Care. We do try and coordinate that on behalf of the communities where our clients live, and are sometimes able to provide that friendly visitor or occasionally that assistance with transportation through our volunteer resources. So,
Okay, I'm just going to pause that there. But one thing I really like about the YouTube videos is that sometimes it can be a bit difficult to just read through a bunch of text and really be able to absorb it. A video where you have someone talking through the supports and the information available is sometimes just a lot more easily digested.
I agree. It's much easier.
Right. So I'm gonna go back to the PowerPoint. Let me know if you can see the PowerPoint.
Yeah.
Okay, perfect. So I'm also gonna share you the Caregivers Alberta website and how to access those resources after the meeting, just because it's about 30 to 40 different documents depending on your specific situation. Okay, so has anyone here heard of the Caregivers Bill of Rights?
Nope.
Okay, so it looks like we have one person on Facebook that's heard of it. So a lot of people will hear about a patient's Bill of Rights, especially with action plans and self-advocacy. Patient Bill of Rights has become a lot more well known. What isn't as well known is Caregiver Bill of Rights. So for a caregiver, they have the right to take care of themselves. It's not an act of selfishness. And we're going to go through the Bill of Rights because it's a great tool for caregivers to keep in mind. So they manage that burden, they manage to avoid burnout, and in turn be better caregivers because they are taking care of themselves as well as the patient. So to seek help from others, even if the loved one or the patient may object, it's important to recognize one's own limits in terms of endurance and strength, and that there is no shame in seeking assistance. They have the right to be angry, depressed, or be frustrated, or express their difficult feelings because it is not an easy situation that they're in. And they have the right to maintain, parts of their own life that don't include their patient, just as they would if they were healthy. And they have the right to do some things just for themselves. They have the right to reject attempts to be manipulated, whether it's through guilt or anger, depression, or frustration, either consciously or unconsciously. by that patient. I'm not going to go through all these. Just one last one. They have the right to take pride in what they're accomplishing and to apply the courage it takes to meet the needs of someone else, as difficult as it might be. And then a patient care checklist. Who here has used a patient care checklist before? So if you have a green sleeve, your green sleeve may have a patient checklist in it.
Good list, yeah.
Okay. Anyone else? Okay, so I think that's a sign that after we post the caregiver resources, we will post information about the green sleeve. The green sleeve is kind of like your medical passport. It has information about your primary care physician, your condition, your medications, and it's a really useful tool for anyone with a chronic condition, just to manage their appointments, their symptomology, and various appointments, regardless of whether it's with your family physician or a specialist. It's a really good tool to sort of track your own medical journey. But getting back to the checklist, a patient care checklist is usually used to ensure you can meet the needs of your family member or friend's needs. A caregiver's checklist is the same thing, but it's meant just for caregivers, so they are well cared for too. So things like physical care. Are you eating well? Are you exercising regularly or keeping active in a way that meets your needs? Are you getting enough rest? Are you seeing your doctor as needed or managing your medications or any other health conditions you may have yourself? When it comes to mental health, are you doing activities that you enjoy? Are you taking breaks from caregiving? Do you have social supports? Do you have someone that you can speak to freely about the challenges that you face as a caregiver? Do you believe in the importance of what you're doing? And then for the caregiving health portion, that is accessing support services in your area that are available. Understanding your relative's health needs and prognosis to understand how you can best provide that support. Have you communicated with others about how they can help provide that support, whether it's through a agency or a government support service, or even if it's a relative or family member that can help you be a caregiver by sharing responsibilities. For example, I share responsibilities for my grandparents who are in their 90s. I manage their medical stuff, and my sister manages taking them to appointments. So that'd be an example of sharing the burden. Okay, and there are a few caregivers specific support groups. So the Canadian Pulmonary Fibrosis Association, which is a group that we are part of, has a national virtual caregiver support group just for caregivers of patients with pulmonary fibrosis. It is by registration only. So if you would be interested in it, you would have to email Roberto Zabata. He is the national group leader. If anyone is interested in that, let me know. I can send that over and it'll be part of the newsletter. Okay, and there's also Caregiver Connections. So Caregiver Connections are almost like a casual peer support network where, similar to our coffee chat, caregivers get together and they discuss their challenges, tips, skills that they found helped, as well as sharing their personal stories to sort of share that burden. I'm going to see if I can. Oh, sorry, guys. I'm just going to run through this really quickly. I'm going to see if I can share the CMHA website because they do have groups throughout Canada. So there's one for Edmonton, there's one for Calgary, there's one for Red Deer. Okay, can everyone see my screen?
Yeah.
Okay, so CMHA, the Canadian Mental Health Association, runs groups specifically for caregivers. They understand that caregivers need support and understanding, so they're here to help navigate that. I'll scroll down here. So as you can see, there's a bunch of groups. There's one in Red Deer, Grand Prairie, Fort McMurray, Lethbridge, Camrose, Edmonton. One nice thing about these groups is they are virtual. So even if you, let's say you live in the greater Edmonton area, but you aren't from Edmonton, they would allow you to join that group. And this is also something that will be included in the newsletter and, you know, be mentioned on the page afterwards. All right, so that was a lot of information, and there's even more information out there for caregivers as well as patients. Are there any questions? Okay, so it looks like there's one question on Facebook. Oh, that's a detailed question. It's a good question though. I am a caregiver for family members that are not permanent residents. I am not sure what supports would apply to them because they are not 65 yet. And because they're not permanent residents, they don't qualify for most of the senior benefits. So that's a really difficult situation to be in. Alberta doesn't have a program for this. BC and Ontario do. What this program does is it'll make modifications and it will create an opportunity for these patients to access some of the same supports as someone who is a permanent resident or someone with Canadian citizenship does have. When you have someone who is a landed person, but not a PR, not a permanent resident, usually the best thing to do is have an expanded caregiver system. So if you have family from your country of origin, reach out to them, create a global network, because they likely will still be able to access services and care in their country of origin. And then you would work with the Canadian government, the federal government, to see if any of those cares if any of those supports overlap. So for example, India has a program called NRI Seniors. So NRI stands for non-resident Indian. If you are a non-resident Indian who is not a permanent resident and of a certain age, in India it's 70, and you require care but you can't access it in Canada, the Indian government will arrange for you to be assigned an international medical social worker. This worker will go and help you navigate what supports are available and what the Indian government is willing to fund / accommodate so that patient can get similar care. It's not perfect. Unfortunately, Canada doesn't have a lot available for people who live here that aren't permanent residents, but it is something. So I would recommend that you email the info at PF inbox, and I can give you further information on that because it is a very it's a very detailed process. So we probably can't get into too much here. I'm already running over time. So I'll just recommend that you email me afterwards and I can run you through how that option works, because you mentioned that you're from the Philippines, and I'm pretty sure the Philippines has a similar program as India. Before I let everyone go, are there any other questions? So it looks like we don't have any other questions. So thank you guys for staying 6 minutes over the time. Have a great night, and we will have the information available as soon as we can on the website, links for the supports, as well as for the newsletter and all the links that we went through for those resources.